Hello YouTube, I'm Dr. Fox. Today, I'm gonna talk about which method of contraception suits you. You can choose from a range of contraceptive options depending on your health and circumstances. Your doctor can give you full information on which one suits you best. So first of all, what does effectiveness rate mean? The effectiveness rate is the percentage of women who use a method without getting pregnant within 1 year. So if we say that a method is 99% effective, that means that 99 out of every 100 women using it will not get pregnant in the course of a year. When you are reading or talking about effectiveness, you will often come across the words if used correctly. For example, on instruction leaflets. That means that the effectiveness rate is some methods depending on you remembering to do certain things such as take a pill at the same time every day or use the contraceptive in the right way. For example, making sure a condom is on properly. Then question, which contraceptives have the highest effectiveness rate? There are 4 contraceptive methods which have a 99% effectiveness rate. There are the contraceptive implant, which lasts up to 3 years, the intrauterine system or IUS, which lasts up to 5 years, and the intrauterine device or IUD or coil, which usually lasts between 5 and 10 years. Then there is sterilization, either male or female, which is permanent. The next group has contraceptives, which are 99% or more effective if always used correctly, but in real life has an effectiveness rate of less than 95%. The first of these is the contraceptive injection, which you have to remember to have renewed every 8 or 12 weeks, depending on which type you are using. Then there is the pill, either combined or progesterone only, which you have to remember to take either every day or every day for 3 weeks in the month. And there is also the contraceptive patch, which you have to renew every week for 3 weeks each month, and the vaginal ring, which you must remember to get renewed once a month. Natural contraceptive methods can have a 99% effectiveness rate if you use them exactly as you are told. These include the simple thermal method, where you have to check and note your body temperature and your cervical mucus at the same time every day. The effectiveness rate of condoms changes according to whether you are using a female or a male condom and whether you use them correctly every time. Used correctly, the male condom has a 98% effectiveness rate and the female one has a 95% effectiveness rate. Finally, the diaphragm or cap with spermicide, if used every time you have sex, has an effectiveness rate of between 92 and 96%. Then, what should you think about when you are deciding which method is right for you? You should be honest with yourself about whether you are well organized enough to make contraceptive awareness part of your daily routine, meaning you will always remember to monitor your body, make sure the contraceptive is in place before you have sex, and attend your clinic appointments. You should also think about whether you want a contraceptive which you only use when you are having sex, or which you have to take every day, or which you don't have to think about for long periods of time. If you are looking for something to use only when you have sex, consider a condom or diaphragm. If you can rely on yourself to remember to take everything every day, you could think about the combined or progesterone only pill. If you prefer something which doesn't need a daily commitment, you could use the contraceptive patch, which has to be changed every week, or the vaginal ring, which you change every month, or contraceptive injections, which last between 2 and 3 months. If you want something considerably longer term, your choices are the implant, which lasts up to 3 years, or the IUD or IUS, which lasts between 5 and 10 years. Another question to ask yourself is whether you feel comfortable inserting something into your own vagina. If you don't want to do this, then the cap, the vaginal ring, and the female condom are not suitable for you. Also think about whether you mind seeing changes to your menstrual cycle as some contraceptive methods affect your periods, including the pill, patch, injection, IUS, and vaginal ring, all of which may cause your blood flow to be lighter or less frequent. Okay, question. Which methods can you manage yourself and which do you have to go to the clinic to have fitted? The IUD and IUS and contraceptive implants have to be fitted in your uterus and arm respectively at the clinic. You also need to go to the clinic for the contraceptive injection, which goes into your buttock, thigh or abdomen at least for the first couple of times. After which you can do it yourself if your healthcare provider shows you how and you feel confident in doing it. Okay, next question. Can you use contraceptives if you smoke? Most types of contraception can be used by smokers, including the IUD, IUS, implant, injection, and progesterone-only pill. However, if you're over 35 and a smoker, you should avoid a combined pill, patch, and vaginal ring. Okay, next question. What about if you are overweight? Again, you can still use most types of contraception, although if you are extremely overweight, your clinic will advise against hormonal methods. Remember, most contraception methods do not make you gain weight, even if some research suggests that the injection can cause a small amount of weight gain in women who use it for 2 years or more. Okay, next question. Are there any other health conditions should you know about when you are choosing your contraceptive method? Some contraceptives contain the hormones estrogen and progesterone, which are not suitable for women with breast cancer, migraines with Euler, and problems with blood circulation, or if you are taking certain medications. So always remember to tell your clinic staff about any other drugs you are taking. If this is your case, consider using the IUD, condom, cap, implant, injections, or progesterone-only pill. Okay, next question. What if you only want to take contraception for a short period? If you are planning to get pregnant soon, so it is important that your fertility returns to normal soon after you stop using contraception. You can either use a cap or condom, which have no effect on your fertility at all, or your clinic will recommend the implant, IUS, IUD, or progesterone-only pill, as you will be fertile again within 1 month of stopping any of these. If you have contraceptive injections, it may take a year for your fertility to return to normal. Okay, last question. Is there anything else you should consider? Always remember that the condom is the only contraceptive method which protects you against sexually transmitted infections or STIs, so if you feel there is any risk, use a condom as well as whatever other contraceptive methods you have chosen. Okay, thank you for watching. See you soon.